Hi, everyone. This is the third session of the Girls to Industry program. Today we have Dr. Fuchs, and she'll be going over her position and her experience in the pharmaceutical industry. So we'll just begin off with some housekeeping rules for the day. And again, this session and all other sessions are recorded. So if you or your friends need to just drop from the call, that is completely fine. We'll provide the recorded version later this week. And just like last time, if you have any questions, please keep them until the end, and you're allowed to definitely turn on your sound and ask them directly to Dr. Fuchs whenever you are allowed to. And if you want to send them privately to us, you can also do that as well. So again, just remember to not spam in the chat, just be respectful with everyone's comments, and also be sure to complete your post-meeting survey, which will go out later this week. All right, so today we have the pleasure of talking to Dr. Nicole Fuchs. She has a really deep passion for helping younger students. She has years of experience working with the IPHO, which is a pharmacy organization. And I'd like to introduce you all to Dr. Fuchs. Dr. Fuchs, you can take it away.
Thank you so much. I'll go ahead and share my screen now so you guys can see. Thank you so much for having me. I've been looking forward to talking to you guys and sharing my experiences. So to start, a little bit of personal background. I was born and I grew up in Berlin, Germany. So I lived there for 10 years. So my immediate family is still in Germany. My grandparents, aunts, uncles, cousins, everyone besides my immediate family, like my brother and my parents, are all over there. So I definitely still have a lot of ties to Europe and especially Germany. And once I moved to America, we moved to Grays Lake, Illinois, which is a suburb in the surrounding Chicagoland area. And on my next slide, I'll go into my education. So I went to high school in Grays Lake. Then for undergraduate, I went to Loyola University in Chicago. So as you go through talking to a lot of students, networking, you'll see that there are some pharmacy students that do a 0 to 6 program, which are usually on the East Coast. So right after high school, you can apply and do an immediate program where you do 2 years of undergrad prerequisite courses, and then you basically have a granted admission into the pharmacy school. So you come out 2 years younger than other students would have. So for me, for instance, I did 4 years of undergrad and then 4 years of pharmacy school, versus other people can get that done in 6 years. So if you're still in high school or you are kind of considering a route into pharmacy, I highly recommend for you guys to look into some programs that offer 6-year programs or even 5 years, since they definitely exist and they can kind of shorten your time in getting your pharmacy degree. So I didn't know that I wanted to do pharmacy right out of high school. I actually started out as a nursing major. So I did 2 years of nursing school at Loyola. And right around my sophomore year, I started to realize that nursing is really not the path for me. I knew I wanted to be in the healthcare field. I knew I wanted to help patients, but I just realized that me helping patients doesn't have to be a direct impact, meaning I didn't have to touch them directly in order for me to impact their lives. So that's when I started to browse other healthcare careers. I looked into physical therapy, occupational therapy, PA school, but ultimately I ended up choosing pharmacy after connecting with a pharmacist that works at Astellas, and he really introduced me into the pharmaceutical industry. So that's what really sparked my interest in not only pharma, but specifically pharmacy. So right around junior to beginning of senior year, I decided to apply to pharmacy school. I ended up getting my bachelor's of science degree from Loyola, and then I was fortunate enough that I was accepted into the University of Illinois College of Pharmacy. So I started at my pharmacy curriculum in 2017. And really starting from there, I knew that I wanted to be in the pharmaceutical industry. I was open to other areas. I have worked at a retail site like CVS Pharmacy for the past 6 years now. I've had rotations in clinical sites across numerous different hospitals, but I always ended up coming back to the pharmaceutical industry. And that's where I saw my strengths really being highlighted the best, where I saw my career goals aligning the best. So I've ultimately always knew I wanted to end up in this career. And I'm lucky enough that that's how it ended up with my fellowship and where I am in this today, really. So in pharmacy school, there are a lot of leadership organizations and activities that students can get involved in. So the number one organization that I think most students have heard of when it comes to the pharmaceutical industry is IPHO, or Industry Pharmacist Organization. It exists, or there is a chapter basically at every single school, or almost every single school to this date across the whole nation. And if there's not a chapter at your school, feel free to reach out to me and I can connect you with somebody that can help you get started and start a chapter at your own pharmacy school if you choose to do that. And if not, you can always get involved through the national organization if you don't have anything locally that you're comfortable in getting involved in, or you have the ability to. So starting my P1 year, I applied to be part of the leadership organization. I was elected as P1 liaison, and from there every year, my involvement with the organization grew. My P2 year, I was director of social media and marketing. And after that, I really enjoyed working and having a local impact working with students at my school at UIC. But I always wanted to just learn more about how the organization operates on a broader scale across the whole nation. So I ended up just putting all my eggs in one basket. I really didn't think I would get selected. I really think that I got very lucky that year that I got elected as a national student member for social media and marketing. So my P3 year, I was vice president at my local chapter, but also involved nationally as director of social media and marketing. So I ran our social media sites like Instagram, Facebook, LinkedIn, and then got to connect with various different students, both nationally and locally across the whole organization. So I've always really enjoyed and spoken very highly about the Industry Pharmacist Organization, or IPHO, since it really helped me develop my professional skills very well, even further than I would have on my local chapter, but it also I ended up having the ability to connect with students across the whole nation. So even as a fellow now, there's so many students that I've worked with directly and indirectly through IPHO that I'm familiar with, and we just know each other from emailing or kind of like a video chat like this that I was lucky enough to be able to connect with them. So if you guys are not part of IPHO, I highly recommend for you guys to get involved in. Definitely attend all their webinars, their meetings. Some of them are free, some of them are not free. It really depends on what the event is, but I highly think it's a really good investment for you to get involved in, especially since it helps you professionally, but also helps you connect with students. And then when it comes to the interview process or professional development, I think that's the number one question that most students will have today, or will have when it comes time to a fellowship. So when it came down to me applying for a fellowship, I was fortunate enough that I have had a few industry experiences in the past. So I've had 2 internships, leadership experience, and I was pretty familiar with the fellowship process. My year was when COVID was rampant, so the whole process changed to being completely virtual, which was entirely new for me and the rest of my class of 2021. So we were in a different situation where we were able to apply to more positions than you traditionally would have if you were in person. So before COVID, there was a cutoff of maybe 10 positions you can apply for. But because of the virtual platform, I was able to apply to various different internships and fellowships. So starting with my internship, I was very determined to have any sort of experience throughout pharmacy school. So my biggest advice to anyone that's still a P1, P2, even P3 that has a summer that has 6 to 12 weeks fully open, to just try your hardest and no matter what, apply to as many positions that you possibly can. I applied to over 100 different internships my P2 years. And even if you're applying to 100 different internships, these are getting more and more competitive as the years go on. So even if you are applying to a number of them, doesn't mean you'll get an interview or will get selected. So even though I applied to so many, I only was able to receive about 10 interviews. From there, I was only able to get 1 or 2 offers. So it shows you the scale of how competitive internships, fellowships, really anything is becoming. And the years go on and candidates become more and more qualified. So you definitely have to keep working and growing with the wave as people become more and more competitive. So if you are really determined to get some sort of experience, if you're not a P4 yet, definitely try to seek out an internship for next summer. And don't be restrictive when it comes to the location or the area. If you might think that you're interested in regulatory affairs right now, when it comes to an internship, an experience is an experience. It really shouldn't matter, and you shouldn't be restrictive. If you have the ability and you have no ties, you're not married, you don't have a child, and you're able to live somewhere else for about 2 to 3 months, definitely do it. Apply to California, apply to New Jersey, Texas, you name it. If you see an internship, just apply. Don't be restrictive, and the more open you are and the more you're willing to take a chance, the more doors will open for you, and you have more options to get that experience versus if you're only selected and don't want to leave Chicago or New Jersey. So definitely try to not be restrictive and just don't limit yourself to anything. Again, apply to as many positions as you can. You might not be interested in regulatory affairs or medical affairs, but an internship is an internship, and it's still a foot in the door. And no matter what, it's a story that you can tell in your interviews. You can tell that, regulatory affairs was a great experience, but that's not where you see yourself in 5 to 10 years. And you were able to learn from there and then be able to connect with other professions. And you know that medical affairs is where you want to be long term. So again, don't restrict yourself functionally or location. And again, the same goes with a fellowship. A fellowship is also very competitive. I don't know the stats, but I think it's about like less than a 2% chance of you getting a fellowship. They're becoming very competitive, and there's not enough of them for the number of candidates that are coming out every year. So that too, keep in mind as you are browsing fellowships or looking where you want to end up in the next couple of years. If you are restricted to one place, that can really hurt your chances of getting a fellowship, especially if you're not willing to move to New Jersey, which is the mecca of pharma, or even Boston, which has a lot of biotechs. So that is also something that you should keep in mind in the back of your mind as you go through pharmacy school, that you might love Texas or that's where your family is, but more often than not, you can't really be restricted and just be bound down to being in Texas forever. More often than not, whether it's a residency, fellowship, internship, you have to get out of your comfort zone and experience something else. And when you do that, it's the biggest growth experience that you can have for yourself. So I highly recommend for anyone to do that. Just take that risk and try something new for once, and you'll have no idea how much you'll be able to grow professionally, but also personally from that experience. So when it comes to work life, I'm switching gears a little bit. I'll be talking more about what I'm doing now as a fellow. So I'm currently the Hematology Medical Affairs Fellow through Bristol Myers Squibb in conjunction with Rutgers. So it's a 2-year fellowship. So first year I'm working on the US team. The second year I'll be working on the worldwide or global team. So I started about a month ago. And so far, a lot of my day-to-day work life or tasks have been around meeting with my managers and mentors, aligning on various projects and deliverables. So right now it's really we have less than a half year left of 2021. So a lot of the meetings we're doing is in preparation for 2022. And the way I like to describe my role is you're really the bridge between different cross-functional areas. So medical affairs is in the middle, and you work with commercial, clinical development, regulatory, and you all align on one specific product or tasks. So going into 2022, we're working with clinical development or HEOR on studies that we want to focus in on for next year. And then we as medical affairs look strategically what we can do in order to support those studies and what the brand specifically will need. And that's where advisory boards will come in. So we set up advisory boards where we talk to various different doctors, and not always doctors, it could be nurse practitioners, pharmacists in the field that we have identified, and just seeing how they are using our product, what they are using for a certain disease, and what they are seeing day to day that maybe the company doesn't know or isn't focusing in on. So having those insights, we're able to tailor our strategy accordingly, just to make sure that we are aligning with those physicians and we're moving our brand forward in a way that will make us profitable, but also impact the lives of our patients. So that's where we work with a lot of KOLs and also have our MSLs in order to bring those insights into us internally. So that's some of the things that we're doing high level. It's a lot of working with other areas, again, commercial, clinical, HEOR, just to make sure we're all on the same page and we're we're thinking strategically for the next couple years, 6 months, you name it. Also planning for meetings. So we have numerous meetings that happen every single year, congresses. Again, half of them are virtual now, which is unfortunate, but the ones that are in person are great for networking. You can learn more about what your competitors are doing, present data yourself, and then also have your advisory board centered around there, since a lot of data for studies is released around those certain congresses. And then besides that, as a fellow, your main role is to network and build your connection kind of throughout pharmacy school as a student. That really doesn't go away. As a fellow, you are there to connect. And in the end, your network and your connections are what's going to get you the job. You do have to do a good job with your projects and your work. But at the end of the day, like anything else in pharmacy or even outside of pharmacy, it's all about who you know and the impact that you're able to make. So not only just getting to know my team members, my higher ups, but also getting to know other fellows. So at BMS, we have about 10 first years and 10 second years. So just growing my network and getting to know my fellow co-fellows, and then being able to broaden that to just the Rutgers Fellowship in general, since there's over like 600 fellows, I think, just within Rutgers alone. So that's part of the reason I also chose that program, is just for the vast amount of fellows and the network that I'm able to gain from there. And then for my future plans, it's changing, I feel like, every week, but my specific fellowship right now is more of a home office medical affairs role. So I have had interest in medical science liaison role or field medical, just because I've had a vast amount of experience in those specific roles before, and I'm very comfortable with it. And that's why I chose a fellowship that kind of collaborates more with that, or I guess it kind of combines my previous experience with a new area of concentration. So that's why I chose something more home office focused, which is medical strategy. So I am open to both an MSL role, but recently more so a home office, just because based on what I've been seeing, I really like being able to collaborate with other members and then think strategically in a teamwork setting. So that kind of is the difference between an MSL and being in a home office setting. An MSL is very much an independent contributor. You work on your own, you get your insights, you set up your own schedule, versus in person or home office medical affairs, you collaborate with your team members, but also cross-functionally with other members of the team just to hit certain deliverables and projects. And an example of that is, like I said, pre-launch and new data and new indication, moving the brand forward when it comes to medical tactical planning, and just thinking ahead when it comes to maybe your competitor data coming out and how you as a brand will position based on something new that might have come out in that field. So woman to woman, I really stress that you should not be afraid, you should not be intimidated. And although it might seem like there are a lot of men both in the pharmaceutical industry and outside, I think that I have more friends that are women actually that work in the pharmaceutical industry than men. So I think that's something that should make all of you guys feel better, that you definitely shouldn't be intimidated. It's very progressive, especially from my experience, or at least the companies I've worked for. I think that it's more progressive than other roles, maybe in a hospital or retail setting. I definitely think that equality is apparent, and it has to be apparent, especially in 2021 when you work for a large biotech or pharmaceutical company. And I personally haven't had any experience or have heard of any woman getting paid less than a man, or being treated like they're any less knowledgeable or intellect like smarter than a man, at least from my experience. I do think that there might be times where a woman feels like she has more to prove, just because of traditional stereotypes that still exist today, that you have to be the caregiver, that you have maternity leave and so forth. But from my experience, I definitely think that there are equally as many women that are in higher positions in the pharmaceutical industry as men. So don't be afraid. And honestly, if you can, just be yourself, be able to show your personality and who you are, but there's also a fine line of being professional, but also showing who you are. So don't be overly open, especially in a professional setting. Know what to share and what not to share, especially when you are talking to people that are in higher positions than you. So definitely walk a fine line, but definitely don't be afraid of anything. And those stereotypes that might have existed a few years ago about the pharmaceutical industry, I personally haven't been able to see it from my experience. So that's a little bit about me. I know that I want to leave some time open for any questions and for us to connect. So this is my email and my LinkedIn. If you guys have any questions right now, just feel free to put it in the chat, or if you want to come off mute or off video, feel free to do that and I'll be able to answer any questions, whether it's from my experience, my fellowship, internship, you name it. I've kind of been through it all, so I'll be happy to share my experience.
Yeah, thank you so much, Dr. Fuchs. That was very extensive, and I'm pretty sure all the students got a lot of information out of your talk. I received some private messages, and the first question was, what is the best method to grow and maintain a strong network?
So I swear by LinkedIn, and I think that's the best way for me to maintain and grow. So no matter who I talk to, whether it was honestly a 30-minute one-time session or somebody that I knew for X number of years, I always connect with them on LinkedIn. It's up to them whether or not to accept me, but more often than not, most people will connect with you. And that's a good way for you to just keep in touch with where they are, if they're still in that current role, and if they're not, where are they going? Just kind of keeping tabs on people, but also gives you a different platform to be able to message somebody if they have a promotion or if they move to a different position. It's a good way for you to like something, leave a comment, or if you're comfortable with it, you can even message them and then set up time with somebody, just asking how they're going, what is new, what made them change positions. And I think it's a very good way to connect and kind of relieves the stress of just sending an email that might not always be answered. You know that on LinkedIn, mostly everyone uses it and they're going to see your message. And from my experience, more often than not, everyone is super, super open to talking to students and talking to you and just keeping that connection going. So don't be afraid. And if it's somebody that you really hit it off with, or somebody that you want to learn a lot from, don't be afraid to ask them if this can be a reoccurrent meeting, maybe every 2 months, every 3 months, if it's okay with them, if you'll reach out to them every so often, just to make sure you have that relationship that keeps progressing. It's really on you just to ask and then make sure that it happens and then actually stick with it. If you're asking somebody for every 3 months or 4 months, make sure you actually put it on your calendar so you remember, and then just make sure you connect with them every so often, just so you can keep up and see what they're up to and so forth. That's what I've done.
Yeah, I completely agree. Another question that we got is, how do you stand out to different pharmaceutical companies?
That's a really good question, especially since it's becoming very competitive these days. So the number one thing that everyone always sees is your CV. So making sure your CV is really top notch and just doing little things like making sure there's no spelling errors, grammatical errors, it's formatted correctly. So it's not all over the place. It's clear, detailed, and whoever is looking at it can see what they need to see. And if you don't have pharmaceutical industry experience, it's really okay as long as you have some sort of relevant experience. So that's where you kind of have to do the homework and the hard work yourself, because more often than not, your pharmacy school will not help you. So it'll be entirely on you. So whether it is creating a new organization, kind of like this from scratch, it shows that you're a leader, you're innovative, you're able to think outside of the box and then be able to execute it yourself. Putting something like that on your CV doesn't require you to join IPHO or have an internship. It shows that you're able to take nothing and make it into something. And again, if you don't have those direct experiences like an internship or leadership roles, just be able to find something that is still as transferable to an internship or a fellowship, whether I think I lost you for a second.
Yeah, for 1 second, I accidentally left the chat. But yes, thank you so much for offering those words of advice. Ria actually had a question. Ria, would you prefer, or no, actually Ria left, but her question is a 6-year program for pharmacy school from high school a good decision for someone who isn't sure about what they want to be in the future?
I would say no, just because if you are applying to a 6-year program, you basically are committing to a pharmacy school. So my brother is actually doing a 6-year program at Purdue. So right out of high school, he applies to pre-pharmacy. So you're not directly in the pharmacy school. You still have to apply at the end of your 2 years. But if you're already doing a 0 to 6, you already have a huge leg up versus somebody that's coming from nothing. You're already doing the prerequisites, you know, the professors, and you're already in that school. So more often than not, as long as you're able to have a good interview, you're going to get into the pharmacy school. So I recommend, if you're not 100% sure you want to do pharmacy, is just to choose just normal prerequisites in the science area. So whether it's just choose a bachelor's degree for now, see how you like chemistry, see how you like bio, especially orgo, and then take it from there. If you go through bio and chemistry and you just hate your life, I would highly reconsider just any career in the health sciences and especially pharmacy, since it is very chemistry based. And you have to enjoy, I think you have to enjoy science in order to enjoy your career. And that's kind of something I told my brother as well. If you go through orgo, biochem, and you just hate everything about it, maybe pharmacy isn't for you. So if you have any sort of doubt and you're still in high school, I definitely would not risk it, especially if you are willing to commit to a program in case you need to drop or anything. You want to have other options. So I would just play it safe and keep it broad, whether it's bio, physics, any sort of major, and then just see how you like the prerequisites before applying for pharmacy school.
Mhm, mhm. Exactly, exactly. I agree on that.
Those
Another
programs are great if you know for sure you want to do pharmacy and you know it's a clear way, 0 to 6, and you're done. But if you have
Mhm.
any doubt, I wouldn't do it.
Right, right. Another question, which actually is related to classes, is what are the best elective P4 API rotations to take if you're interested in industry pharmacy?
So it kind of depends on what your school offers. So depending on your school, you might have some industry electives that are already established through your school. So with my school, we had contracts with AbbVie, Astellas, and like the FDA. But I always urge students to go outside of what's already established. Depending on how your administration is, they might be accepting, they might not be. I've heard of students reaching out to current fellows on LinkedIn, asking them to be preceptors, the fellow agreeing, and then going back to the school and the administration being okay with it, and then setting up an app before you. But then there's other schools that are very strict and do not want you to do that and want you to just apply internally through their school. So definitely don't let anyone limit you. If you're able to set up your own rotation, definitely do it. Connect with professionals on LinkedIn, current fellows, and then go through your school administration just to see what they have to offer. Whether it's through an FDA, a pharmaceutical company, even consulting is a great way to get some sort of experience. And even if you don't have any industry rotations, you can still get a fellowship and you can still get a job in the pharmaceutical industry. You just have to seek out the experiences that are transferable. So again, project management skills, communication skills, time management skills, organizational skills, things like that are all things you'll be doing on a day-to-day basis as a fellow or as a professional, and you can get that working in a hospital or even retail setting, as long as you're able to talk to your experiences. And really quickly, if your school is willing to have you set up your own appies, there are a few that you can just apply to yourself externally. So Exenda is one of them. Also, BMS does have an external appy that you can apply for, but you need to get selected first, and then your school will set up an appy more often than not. So there's other opportunities, just Google it. I think every year there's more and more that probably pop up because they want the free labor and they want to give students the opportunity to come. So definitely just Google it. Google like company, I don't know, Amgen, BMS, Pfizer, Appy, and see if anything pops up. And also don't be afraid to reach out to any alumni. Maybe they're willing to be a preceptor for you. Definitely start earlier rather than later. You definitely want something before P4 year or it's too late.
Mhm. Yeah, I agree on that too. Another interesting question is, what is the most important trait in a potential employee?
That's a good question. I think no matter the setting, it's definitely communication skills. Whether you're in retail or hospital or industry, being able to communicate is the most important skill. Being able to take feedback well and then be able to come away from that, whether it's negative or positive, learn something from it. And then if you have a conflict with someone, whether they have an issue with you or you have an issue with someone, being able to communicate and grow from that is something that's really important. So I would say communication skills and just being somebody that is easy to talk to, not judgmental, things like that. And in the end, no matter the employee, they're always looking for somebody they want to work with. They don't want to work with somebody that is uncomfortable or shy. They want somebody that they can work with closely and openly and without any conflict. So just be yourself, be as open that you possibly can, and just try your best. And I think that comes across very well when it comes to interviews. I think more often than not, we can tell when somebody's faking something or they're being genuinely themselves. So just be who you are. And then more often than not, you'll see that the people that will gravitate towards you will actually be people that want to work with you. And that's what you want.
I definitely agree on that. For right now, there isn't any more questions, but if students have any questions, are they able to email you?
Yeah, so if anyone doesn't have any questions right now or just wants to connect at a later time, feel free to email me. I prefer LinkedIn, but you can use my email as well. Just shoot me a message, even if you don't have a question and you just want to connect with me on LinkedIn, that's totally fine as well. I appreciate all of you guys' time right now. I know no matter, I don't know where you guys all are, but it's pretty late in Chicago. If you're on the East Coast, it's close to 10 p.m. So I definitely understand if you guys just want to hop off and enjoy the rest of your night. And then we can always connect one-on-one if you guys are comfortable with that as well.
Yes, definitely. Dr. Fuchs has given her email and her LinkedIn here. And like she said, if you want to connect with her, please do, because all of her advice can be really helpful as you're going through pharmacy school or any other health profession, because within all these health professions, the lines are pretty much the same, and any advice that Dr. Fuchs gives can be translated into the line that you're interested in. So thank you, Dr. Fuchs, for this presentation. It was very extensive and just so comprehensive. And thank you to all the participants. And as always, if you would like to listen to the recorded version, you can definitely do that. That'll be sent out later this week. And we will hang back for another few minutes if you have any questions.
Thanks, guys. Thanks for joining and for asking questions.
Okay, so it seems like all the participants have left. Dr. Fuchs, thank you so much. And, if you have any questions, then feel free to email me at the Girls to Industry email.
Sounds good. Thank you so much. Thanks for having me. This was great.
Of course, of course. Have a great day.
Best of luck as you start school. Keep in touch.
Okay, I will. Thank you.